What's going on, everyone? Happy Monday. Hopefully everyone is doing well, staying safe, healthy. I hope you had a great weekend. If you had taken a COVID test, flu test, or a test for some other virus, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Monday edition of the Virus Update for Monday, March 3rd, 2025. If you're new to my channel, welcome to my channel. This is where I do daily virus updates on all those viruses that can make us sick. There's a lot of viruses out there. A lot of people have been sick this winter. In fact, you're going to see a poll that I took on X that states, yeah, a lot of people knew someone who got sick this winter. Want to stay informed with the latest updates, the news, the data, everything that I report on? Just subscribe down below. Give this video a thumbs up. The more people that hit that like button, the more YouTube is going to push out this content. Share this video with anyone you know, and of course, leave your comments down below. Alrighty, we do have a few news stories today. We are also going to take a look at some data today, some new data, and there is a bit of a surprise. We often talk about Eastern Pennsylvania. We're going to talk about somewhere else in Pennsylvania today. More on that when we get to that later. And we also have some Walgreens data as well. A quick note on tomorrow's virus update. I don't know if it's going to be a data-filled update, meaning the latest news and data, or if it's going to be something I pre-record, or if it's going to be out in the wild. You'll just have to stay tuned and find out what I decide to do for tomorrow. Tomorrow's the day I get my MRI. Comes right around in the middle of the afternoon. Well, early afternoon. It's going to be around 1:15. I don't know how long that's going to take, and it's not terribly far away. It's about 25 minutes away, but because of the timing of that, we may have to change when I do my recording, so that maybe before some of the data of the day comes in, therefore meaning maybe I pre-record something and upload it later in the day. Alrighty, starting off with the news, and first, a little bit of data from BNO News. Weekly U.S. COVID update. New cases, 162,386 estimated cases. Admissions, 11,367. That is actually up by 2%. That's hospital admissions for COVID. In the hospital, 9,237. That's actually down by 3%. In the ICU, 1,312. That's down by 8%. New deaths, 988. The average is now 943. That actually went up by 4%. So far this year, more than 1.6 million COVID cases have been reported in the U.S., causing 118,226 hospitalizations and 7,824 deaths. So, yeah, that number, the number of deaths, it's still rising, and yeah, COVID can still be deadly. There is proof of it. All right, in a strange turn of events, get this. RFK Jr., he's the head health honcho here in the United States, urges parents to consider measles vaccine for children. The highly contagious virus explained. Yeah, he has, before he was not saying go out. Well, now he's starting to change his tune a little bit because this measles outbreak continues to get worse in Texas, and there are cases popping up in other states as well. Like this, for example. Yeah, this is local here in my area. We often talk about Montgomery County, Pennsylvania when it comes to EMS calls, or we take a look at the Pennsylvania dashboard. Well, we got to talk about Montgomery County, Pennsylvania for another reason. Measles has been confirmed in unvaccinated Montgomery County child. Others may have been exposed. Now, there is a tiny, I say tiny, bit of good news. I just saw a news report on TV. Sounds as if maybe 95% of the county is vaccinated for measles. That's better off than what Texas is doing. Or I would assume that's much better than what Texas is doing. But still, others could have been exposed. We could see this grow. If you go to my website, there is actually a thread from last year, early last year, when we did have a measles outbreak in our metro area. There weren't a ton of cases. It was nothing like the Texas outbreak, but there were definitely some cases. Philadelphia got included in that as well. So this is something to keep an eye on. Measles continues to be an issue. And check this out. It's also an issue up in Canada. 30 confirmed measles cases now in Quebec. Yes, this continues to grow up there as well. So that is not a good thing. Gracie Abrams has now canceled 2 UK dates due to an illness. So, yes, she's still not feeling well, and she is continuing to go on and cancel shows at this point. And I'm not fully seeing just what is still going on here. It says, unfortunately, I am still really struggling with this illness and have been advised that I cannot perform the next 2 nights. I can't tell you how much this breaks my heart. So, yeah, continues to be dealing with an illness. In Tennessee, Tennessee reports third pediatric flu death of the season. Yeah, this is not a good thing. Remember Saturday, we talked about a ton of new flu deaths in children across the country, and here you go again. Another one has been added. Alrighty, now moving on to a poll I took yesterday. I said I would give you the final results today. Did you know someone who got sick this winter? You know, I say at the beginning of my updates, there's a lot of illness going around. Oh, so many people have been sick this winter. There's a lot of viruses out there. Well, out of 464 votes, 93.1% of the people said yes. Only a small 6.9% said no. And a lot of people say COVID, flu, multiple people sick, 2 that ended up on a ventilator. On and on I could go here. Yeah, this is not a good thing whatsoever. Alrighty, I thought we would have a little bit of fun here with a feature on X. It's called Grok. And I saw someone do something with Grok earlier today. They posted a little screen recording. I thought we would ask Grok and see what it says about masking. Does, or let's put do mask work? Let's ask it. Let's see, shall we? Let's see what it says. I assume you're asking, do masks work? Likely in context of preventing the spread of diseases like viruses or bacteria. The short answer is yes. Masks can work, but their effectiveness depends on the type of mask, how it's worn, and the situation. Oh, this is mighty interesting. Here you go. Surgical masks and cloth masks primarily reduce the spread of droplets from the wearer to others. They're less about protecting the wearer and more about source control. Studies like those from the CDC have shown they can significantly cut transmission of respiratory viruses, COVID-19, in community settings. However, read what it says next. N95 respirators or similar high filtration masks are more effective at protecting the wearer because they filter out smaller particles, including aerosols, when properly fitted. So it even talks about proper fitting. They can block 95% of particles down to 0.3 microns. Real-world data, such as from healthcare settings, backs this up. There you go. Effectiveness hinges on fit and consistency. A mask worn under the nose or with gaps is far less useful. Compliance matters. Two masks work best when everyone uses them. Get it? The Grok gets it. If the Grok can get it, you know, Elon Musk's product on X. If that gets what works, you should too. A well-fitting N95 mask does work. See this mask in my hand? This is an N95 mask. Watch. I'm going to show you how simple it is to put one of these on. I think it's good for a reminder. Watch. I put this on just like this. And make sure I get a nice tight fit around the nose. That way no particles can seep in. And look at that. Voila. It is that simple to put on a mask. Get it? The Grok gets it. You should be able to get it too. Alright, moving on. Taking a look here. Here's the website. datareport.info. Let's refresh this. Not much more to talk about here, but actually, let's take a look at this. Looks like this is something that I did not notice. Sharp increase in Dutch workers unable to work due to long COVID. Whoa, what's this all about? Number of Dutch citizens unable to work due to experiencing the effects from long COVID jumped sharply from 3,000 just 2 years ago to 12,000 today. Wow, that's a big increase. Patient organizations such as Post-COVID NL estimates that number could be as high as 90,000 citizens. 90,000 citizens. Hello? That's a huge number. This is a much smaller country than the United States. I think we need to be doing something to solve this problem, and I think in a future video, it may even be tomorrow's video, I'm going to be talking about the cost of these viruses. Because let me tell you something. When I called up to find out what the cost is going to be of my MRI tomorrow, the copay, I was like, What? I couldn't believe it. Yeah, it is not cheap to get these viruses. I mean, you may think, oh, it's no big deal, blah, blah. You go on to have health problems and you don't have the proper coverage, whatever your case may be. I don't care what your situation is. Guess what? It's going to be expensive, and it could cost you long-term health issues. And as we all know, some people get long COVID so bad they can physically not work anymore. Totally ridiculous. We do not do more to prevent long COVID. What's an easy way to prevent long COVID? Not getting infected at all. Putting on one of these N95 masks, which we just talked about. Datareport.info is my site. I thank Steve, my moderator on my site, for posting that. I am definitely sharing that to X after I'm done this video. The viral, and Blue Sky as well, the viral activity level of COVID-19 in Canada is moderate. Flu A is high. Flu B is moderate. The viral activity level of RSV is in the high category at this time. Let's take a look at what's going on with air quality today. Full disclosure here, I have not looked at this today, so I don't know what we're going to see pop up here in a moment. And yikes, not liking what I'm seeing. Well, the West Coast is not as bad as normal. Still some bad spots in California, a couple in Washington, but wow, look what is going on in the plains here. Yeah, the humidity's starting to build, the moisture's starting to build. There is going to be severe weather threat later in the week. I think tomorrow it is, down in the south. Honestly, I haven't been paying attention with the weather as much lately, but I'm going to have to because there is definitely a severe threat down there. And anytime you get that push of air, that does sometimes increase the bad air qualities. And take a look at this. Great Lakes, right on down into the Mid-Atlantic, dealing with some air quality problems. All right, in Pinellas County, Florida, we see, wow, a whole bunch of calls right now. A lot of different things. Only a couple sick person calls. Multiple unconscious person calls. Seizures, breathing problems. Yeah, there's a lot of things going on there. That's not a good thing. But this is, check this out. Philadelphia, on Sunday, only had 682 EMS incidents. As far as I know, and I could be wrong, but if memory serves me right, that is the lowest number of calls for any given day during the winter virus season. That is very encouraging. However, I've been keeping an eye on what's going on in the burbs, the surrounding suburbs, and it's been busy today just outside of Philadelphia. Montgomery County, 13 EMS calls, and I have to admit, I had a delivery this morning where, it was a prescription delivery, so the customer is supposed to grab it. In this case, they did not. I'll tell you why. I hit the Ring doorbell. Person says, can you just leave that outside? I have COVID. Oh, yeah, it's risky. Hey, another reason why it's a great idea to wear a mask, especially if you're a gig worker like me. My goodness. Yeah, there's a lot of sick people out there. Taking a look at what's going on in Chester County. Thankfully, Chester County is less busy than it was earlier. There were a ton of calls in Chester County a little bit earlier. You might have seen that trying to, when I was hovering over, you may have seen what it looked like earlier a little bit there. Sick person call, respiratory difficulty call. Yep, there's still calls to be had out there, and it's going to be very interesting to see what Wastewater shows tomorrow, because I'll give you another metric I can tell if people are sick. There were a heck of a lot of delivery requests over the weekend when I was out on Saturday morning and Sunday morning, way more than there have been. It could be because it's tax return season too, and that causes more people to order, but I also notice when people are sick, delivery requests go up. I can't say what it was like back in January or early February. Why? Well, because I wasn't out. I was sick. All right, moving on now. Taking a look at the Pennsylvania hospitals. I need to refresh this. Yeah, I didn't think that was correct. There's Lancaster Hospital having a problem. Few in southeast Pennsylvania. Lehigh Valley's getting slammed again. St. Luke's Monroe campus is getting hit again. St. Luke's Carbon. St. Luke's Miners campus. Yeah, there's a lot of problems here. Geisinger, St. Luke's. Yeah, we have a lot of problems going on. Not bad at all in New Jersey, although there's a few hospitals. You do not see Princeton. Penn Princeton Medical Center does not show up today. That's a good thing. But there are some diverts going on here at this time, so never good to see that. All right, going back to Pennsylvania for a moment. We always talk about eastern Pennsylvania everywhere else, but we never talk about any data from Pittsburgh. And there was one bit of data here that I wanted to show you. Now, there's several different viruses listed on here. There's one in particular that I want you to see. Take a look at this. Pertussis. Whooping cough. This is in Allegheny County, Pennsylvania. Pittsburgh's in Allegheny County, Pennsylvania. And of course, it's refreshing on us. The point I was trying to bring up, and we will get this back. The point I was trying to bring up is there is currently, in 2024, preliminary data. There we go. a massive increase in the number of pertussis cases. And you know what? Let's see if we can't, yeah, that's better. It's right here. 4,728% increase. That is a humongous increase. Again, 338 cases, 2023. They had just 7 cases. Just 7. That's it. And it went all the way up to 338 cases. I hope that trend does not continue this year. That is totally ridiculous. Alrighty, moving on now. We are taking up a lot of time today. So we have Walgreens yet to come. And I did promise you we would get to some of those wastewater sites today as well from CDC. Taking a look here. New York State, 813 cases were added, the most recent update. And we do need to take a look at 2 things here when it comes to hospitalizations. First off, statewide, New York State, 797 and 72 people in the ICU. Taking a look at New York City. And check this out. Yeah, New York City is they're still elevated. I hope they have peaked. We're going to have to see what it shows tomorrow. In the hospital, 335 and 36 patients in the ICU at this time. All right, the latest variant of COVID is LP.8.1 at 42%. All right, taking a look now at Walgreens, and we're going to start off looking at the flu because I was looking at this a little bit earlier and noted here that the current positivity rate for flu is 5.02%. Total test, 6,807. I don't know if that is less tests than last week. If someone wants to go down and watch my video last week, I know one of the videos last week I did show the influenza A and B positivity tracker from Walgreens. Let me know if that is less tests because let's zoom in here just a little bit. We really need to zoom in. You can see here the drop. It was down to, what was it at? 4.83% last week, or whenever that was. And it's gone up a little bit. So that's not a good thing to see. I mean, you know, the flu peaked once, and then it went back up again. And this time it had a bigger drop, and I hope we're not headed towards territory where it starts going up yet again. All right, before we take a look at a few states for COVID and a few states for flu, let's stop and take that hydration break. Today's drink of choice is juice. Of course, water is probably the best thing if you really need to be hydrated. Or Gatorade. Gatorade's a good thing as well. Alrighty. That was refreshing, wasn't it? Let's take a look at a few states here. Maine, the positivity rate, only 10 tests done. That is 10%. New Hampshire, 9.09% positivity rate. And I'm seeing something going on in Utah that looks bad. 33 tests, 9.09% positivity rate. Wisconsin is currently at 8.45%. Texas, look at that. You were dropping in Texas. Now all of a sudden, Texas starts to go up again. 1,263 tests. That's a lot of tests. And the positivity rate is up to 5.5%. Florida at this time, 4.37%. How about Oregon? Oregon is at 17 tests, 5.88%. You do a lot of up, down movement. Most recent movement is back up again. Washington State, 4.62% and dropping at this time. Taking a look at COVID now. And we can see here, the national positivity rate for COVID went down a little bit. This is good. 11.8%. That's down by 0.2% from last week's 12%. Total tests, 6,762. That is down slightly from 6,781. Taking a look at Oklahoma, we can see here Oklahoma, positivity rate went up 17.4%. That is up by 8.4%. Testing went down 46 versus 67. The majority of these states testing went down, but look at Virginia. Virginia testing actually went up 196 versus 178. Positivity rate 15.8 versus 11.8, difference of up by 4%. How about neighboring West Virginia? Yeah, 48 tests versus 38. Positivity rate went up by 4.6% to 12.5%. Louisiana, take a look at this. Testing only went up by 1. Positivity rate went up by 8%. 13.5% versus 5.5%. Yeah, what's going on here? We got some problems in some states this week. California, positivity trend, 10.8% positivity rate versus 7%. That's up by 3.8%. Testing did go down. 176 versus 215. I'm seeing green in Washington. That should be a good thing. Yeah, testing down, 65 versus 91, and yet the positivity rate still dropped. 3.1%, that's down by 1.3%. Massachusetts, I'm seeing an increase there. You don't do very much testing, just 9 tests versus 11 last week. 11.1% positivity rate. The prior week was 9.1%. That's up by 2%. New Jersey, you're seeing some red there. That's not good. 14.5% testing did drop. 228 tests versus 241, which is why you're seeing that 2% positivity rate increase. How about Maryland? What's going on there? Positivity rate went up there as well. 17% positivity rate versus 12.5%, difference of up 4.5%. Total test, 94 versus 88. And Illinois, I want to know why you're going up. Illinois, 15.6% testing drop, 488 versus 509. That's why you're up by 2%. All right, we're running short on time here. We're going to take a look at a couple things on wastewater. And I want to take a look at Virginia, and I also want to take a look at Maryland. And should we be looking at Louisiana? Yes, let's look at Louisiana from the CDC as well. And I'll explain why in just a moment. Well, you know why. We saw 3 areas there rising, 3 states rising for COVID there. Let's take a look at what's going on with those trends. First off, here's Alabama. Alabama's not doing bad at this time. They still do have some high wastewater sites at this time, but I'm not terribly concerned. All right, taking a look at Maryland. What's happening in wastewater there for Maryland? And let's, can we just turn this on to the state? Yes. Maryland, you're still in the high, and take a look at that. Wastewater says you're going up a little bit again. So that is combined. So you got Walgreens saying you're going up again, and you got wastewater. That's some evidence that you might be actually starting to see a little bit of an increase once again. We'll have to see what the state data says this week. Let's go down to Virginia, shall we? Let's see what's going on in Virginia. Look at that. A little bit of an increase in Virginia as well. That's 2 for 2. I hope we can't go 3 for 3. Let's find Louisiana here, shall we? All right, here's Louisiana. And we take a look at COVID in Louisiana. All right, not seeing the rise there that we were seeing in the other 2 states. That is some good news. But I also want to know about New Jersey. I'm curious, because that was another red state on wastewater scan, but it didn't look like, yeah, okay, wastewater saying there may be a rise there, so we're definitely finding some places that, for whatever the case may be, maybe it's because of that LP 0.8.1, that are starting to see a little bit of an increase. Now, let's take a look at some other places, shall we? We need to go out west. Let's see what California is doing. Remember, places like California, a lot of your immunity from that big summer wave last year starting to wear off. California is still dropping, and you're in the low category at this time. I want to know what's happening in Hawaii. I don't think there's very... Oh, no, there are some wastewater sites there. Hawaii, you had a little bit of an increase to low, and now you're starting to drop, and you're almost back in the very low. That is good to report. And let's also take a look at influenza A. And you know what? Let's take a look at influenza A. We want to go to state and trends. And there's a couple of states we want to look at. One being Maine. Because did we not just see a rise in the positivity rate in Maine? And it looks like Maine is dropping for wastewater for influenza A. Now we're just going to randomly do a few states. How about Florida? We went all the way up north. Let's go south. Florida is dropping. Still moderate at this time. How about California for influenza? Still moderate there and dropping. Let's go down to Washington State on the list. And Washington, take a look at that. Washington is very high. And Washington State is starting to rise once again for influenza A. Wow, you're not far off from back where you peaked at the beginning of February. That is concerning. So Washington, influenza. Yeah, that's not a good thing. How about Ohio? Hopefully Ohio is still dropping. It is. How about North Carolina? See what's going on there. North Carolina is still dropping. And since we had a pediatric flu death in Tennessee today, let's end on Tennessee, shall we? Here it is, Tennessee. And we can see Tennessee is dropping at this time. You're in the moderate category. Alrighty, folks, that does it for the Monday edition of the Virus Update. If you enjoyed this update, give it a thumbs up, subscribe down below, hit that notification bell, and of course share this video with anyone you know. I will see you again tomorrow in some way, shape, or form. Whether it'll be around this time of the evening, whether it'll be early, I don't know. I will figure something out for tomorrow. Till I see you again tomorrow, stay safe, everyone, and have a fantastic Monday evening. Thanks for watching.